Forward a chain email debunking myths from critics, and a coalition of drug makers and unions and hospitals have launched a $12 million pro-overhaul ad campaign. We've got our own debate brewing here as well. We're going to welcome in Republican Congressman McCotter of Michigan, the chairman of the House Republican Policy Committee and a member of the House Financial Services Committee as well. Jeffrey Branch, the Chief Performance Officer and founder of Ability Prosthetics and Orthotics, and Shirley Green, as a concerned citizen of Colorado who's laid off from her job and needs emergency surgery but can't afford health care payments. We welcome you all in today. And Congressman, I would like to start with you. We've seen some of the highlights of the town hall meetings. It's impossible to see them all. But from what you've seen, how effective have they been?
Well, I think any time in a free republic people come together to petition government for the redress of grievances is healthy. And what you find is the polling number shows that the public doesn't want to see this rushed. They think that the current plan is inadequate and can be injurious to what they have, and they would like government to do what we're supposed to do. Now go back in September and sit down and work from the center out and come up with targeted reforms that will help everyone. And I think that's what we're really hearing about the doing.
So you say it's a healthy exercise here. Why haven't you done one so far?
We've been doing telephone town halls at this point because what you see in the town halls now, and I've seen this with my colleague John Dingell and others, is you will have people who vehemently oppose it, people who vehemently support it, and normal people will feel shut out of that process because of the incidents that we've seen and the media has played up. So in a telephone town hall, you have the opportunity to reach thousands more people at the same time.
So is that like a conference call? Is that people can just call in and weigh in with questions like we could do at an analyst conference call, for example?
And they've been very good. They've been very targeted.
How many people have actually called in?
Oh, we've had thousands on the phone. We're collecting that data now.
Really?
They listen. Oh, yeah, it's one of the new techniques we use. And what you avoid is the situation where with cameras and everything and the extremes brought, they look for that media moment. And then normal people don't want to go because of the way they view it.
Well, sure, it gets intimidating. And on that, Jeff, how do you think? Has this been effective so far?
You know, in my opinion, yes, it has been effective. I think that anytime we can draw more attention to the debate, and I think it's interesting to me that being 36 years old and running a highly efficient healthcare company, it's interesting to me that we're trying to do this in 2 to 4 months' time. You know, the longer we can debate this and continue to get the public involved and drive these approval ratings down a little bit, maybe we can bring in more of the issues and maybe debate this for the first year of the administration. You know,
Shirley, Jeff and the congressman were talking about, slowing down this process, seeing some of the criticism of it so far. The effect of health care reform, though, is very real to you in a very real way. Can you tell us a little bit about your situation?
Yes, on the 4th of August, I had emergency surgery, abdominal surgery. And at this point, the bills are starting to come in. I have no way to pay for them. My health insurance, the premiums go up, of course, every year. The deductible goes up, and what is covered by the insurance company is less and less. Out of pocket is more and more. And I know I am not alone in this situation at all.
And Shirley, what is your hope from the conversations you've seen about health care reform?
Well, I would like to see a total overhaul of the health insurance industry. It's been needed for years and years. However, I think some of the discussions that are going on across the country right now are so out of control, it's outrageous. I don't like the way it's going. I would like to see individual committees from every state be formed, and at this point, I'd like to get Congress out of it. It needs to be in the citizens' hands.
Congressman, your response to that?
Well, I appreciate her situation. I appreciate her views, but to pass a law, you have to have Congress. And so what I think we need to do is get back to the sense of the system is not broken. It has problems we need to deal with. Have citizen input into a situation to solve it. A radical overhaul of the healthcare system that relies on reducing the supply through government rationing is not going to do anything but increase costs and create the very situation for far more people that she finds herself in now.
But what's the solution for Shirley now, who's dealing with this problem as we speak?
Well, the first solution would have been to deal with a stimulus plan that worked, as the Republican Party put forward, twice the jobs at half the cost. Second, portability is important. I think creating in competition, free market competition amongst insurance companies, being able to buy insurance across state lines, being able to guard against your future change in status. These are things that we have to do to get them to compete. Health savings accounts, again, add to the portability, so that we aren't trapped with a system whereby with insurance companies that don't compete against each other, we now bring in a government entity that won't compete with anyone either.
Shirley, when you hear about those ideas, what do you think?
Well, I still think that Congress needs to get out of it right now. The citizens need to put together this bill, and then once it is put together, it is legitimate, it is in the language that is understandable by every walk of life, then we can pass it to Congress.
And how would the citizens do that?
They're causing a big problem right now.
Shirley, how would they do? Talk us through how you think that would happen, the citizens putting together a plan. How would that, walk us through that?
Well, take what is developed at this point that so many people do not understand. There's so many misconceptions with it. I think a committee within each state that would be formed would go into the current, I'm not going to call it a bill at this point, the current document, and digest it word by word, put it into decent language, into language that cannot be misconstrued like it is now. Then each region, say your western region, your Midwest region, your eastern region, then would come together, and it would feed up to the point where you have a final document that then goes to Congress for approval. But the citizens who are so involved in this are the ones affected by this, need to be involved in creating this.
I just want to assure Shirley that your proposal may be wildly popular with the members of Congress who would like to get out of this issue for a while.
Might be a proposal out there. Jeff, we've been listening to the back and forth here. Any observations you'd like to add? Well,
you know, as a consumer of healthcare, as a provider of healthcare, and as an employer who offers healthcare to 15 employees, I think that the thing that I see daily, on a daily basis, is that we need to provide in this reform, in this health insurance reform, as opposed to health care, we need to put the insurance back into insurance. We need to give the employees control of their health care dollars, and we need to help people to understand the transparencies and understand how insurance companies operate. And I think a lot of this needs to focus on phases, and the first of which I think needs to focus on health insurance companies. People need to understand. I don't think the general public, forgive me, but I don't think the general public really understands their insurance claim or their explanation of benefits that they receive in the mail after a claim has been submitted.
It's confusing enough already,
isn't it? It's very confusing.
Yep. Well, Jeff, I appreciate that perspective. Congressman, thank you for joining us in the studio today. And Shirley out in Denver, Colorado, appreciate you sharing your story with us today. Thank you very much.